Hi, everyone. Well, welcome, everyone. Nice to see you all. Thank you for joining us for another Learn to Return Learning Network. Today's session, from my perspective, is very timely. We're focusing on what's next for school-based COVID-19 testing, looking towards the 23-24 school year. Learn to Return is a statewide program that's funded by the Washington State Department of Health. It's advised by OSPI and DOH, and it's implemented in partnership with all 9 ESDs and Health Commons Project. My name is Sarah Sutton. I'm the Director for School Programs at Health Commons Project. As always, a jam-packed agenda. We will hear from state leaders, Dr. Kwan-Gett, Lacey Fehrenbach, and Dr. Michaela Miller. They're going to help set the tone for this time together, share their perspective and experiences as informed by the last 3 years and looking forward. We'll then hear from Kim Sanchez and Anna Marie Dufault talking about the future DOH OSPI collaboration and how that will manifest into support for schools, our K-12 leaders. We'll then hear from Michelle Chung, the school testing supervisor at DOH, about the COVID-19 testing supports that you can expect for next school year, along with a couple of important reminders as you wind up this year. Sam Rice is joining us from DOH to review the K-12 guidance updates, and Lillian Manahan as well, doing some surveillance updates, helping us understand what the data is telling us today. I really appreciate folks from DOH and OSPI joining us. I know some of you need to drop after your sections. You are welcome to do so. We're just grateful the time that we have with you today. We will keep everybody muted with the exception of myself and our panelists. Please remember that closed captions are available. You can click the CC button below to enable that on your screen. This event is being recorded. We will share the recording and these PowerPoint slides with you after the event. We will also post them on the Learn to Return website so you can share them out with your colleagues who are not able to attend today. I'd like folks to place questions in the chat. Please know that our presenters have been instructed to focus on their presentation. If they do not have time for questions afterwards, we will collate the questions in the chat, work with the presenters to get you answers. Our goal is to have those answers published in the May 25th Learn to Return newsletter, so next Thursday. So again, please put the questions in the chat. We want to hear your questions. They might not be addressed on the webinar because of time, but we will follow up with you with written answers next week. Our presenters have been fielding your questions over the past few weeks. Health Commons and the ESDs have been elevating your questions to the presenters. So your questions have informed this presentation, and I'm sorry that we don't have enough time to answer all questions directly during the webinar. Great. Well, thank you, Dr. Kwan-Gett, Lacey Fehrenbach, and Dr. Michaela Miller for joining us today. We're going to go ahead and spotlight you in Zoom, so you're going to get big for a minute. Really appreciate you all joining us. Lacey and Michaela, we've been here before. I think this is our 3rd learning network together where we're looking future forward to try to help schools get the clarity and information that they need to wind down the school year and prepare for next year. So Tao, I'll start with you.
Yeah, thanks so much, Sarah, and good morning, everybody. And thank you so much for the opportunity to join you for a few minutes this morning, just to express my gratitude to all of you for the incredible amount of resiliency and adaptability you've shown throughout the pandemic. When the pandemic first started, I hadn't joined the Department of Health yet. I was working as a primary care pediatrician in Seattle. And I remember as both a physician and as a parent of a teen, being so grateful for the incredible efforts and professionalism that schools did in the incredible changes that they had to quickly implement, first to totally adapt to an online environment, and then to bring kids back to school, and then to implement mitigation measures and testing. And, the effort was truly Herculean. And I remember also the fear and uncertainty, in those first waves of SARS-CoV-2, before a vaccine was available. And as educators who work with children, I imagine that many of you probably had some of the same feelings that we pediatricians had. On the one hand, I remember feeling, very grateful that that as we learned more about the SARS-CoV-2 virus, it seemed, not to cause severe illness in most children. On the other hand, I also remember having a lot of fear and uncertainty, fear that kids with chronic conditions, could have severe illness, fear that I could get infected, and fear that I could bring the virus home to my family. And I remember feeling sort of the cognitive dissonance of, seeing kids with cold symptoms, as we do every winter in clinic, and as you do every school year, and realizing that some of these kids with mild cold symptoms could have a virus that could be deadly for me and others. And that's why testing became so critically important, and became such a really foundational linchpin for the public health response, because it was the only way to tell if some of these kids with regular cold symptoms actually did have a regular cold or really did have COVID-19. And I have absolutely no doubt that the tireless work that you did kept people out of the hospital and saved lives, not only for your students, but also their families, your coworkers and their families, and people in the communities who might otherwise have been in the chain of infection. It's sort of the nature of prevention work in public health that, unlike in medicine, where the names of the people that you've helped, in prevention work, you never know the names of the people whose illnesses you prevented. And so while it's not likely that someday somebody will come up to you in the street and say, thank you for preventing my child from being infected, or thank you for keeping my family healthy, I just want to take this opportunity to say that on behalf of the public health system, thank you for your partnership along with our OSPI partners, and thank you for your ongoing collaboration and being such great public health champions as we move out of the emergency phase and into the new phase of this COVID-19 pandemic. And so with that, I will turn things over to Lacey.
Welcome, Lacey. Oh, you're mute.
Yes, this is better.
Good morning. I think we were battling on the mute button there. So glad to be with you all. I'm Lacey Fairbanks.
I'm in the Zoom meeting.
I am the Chief of Prevention at the Department of Health, and
Sure.
I know many of you from my time as the Deputy Secretary for COVID-19 response. I am very honored and grateful to be with you here today. I wanted to note that with the ending of the federal public health emergency that happened last week on May 11th, we recognize that we've brought in yet another transition for you all and school leaders to manage, and are glad to be with you today to determine a path forward and help inform that path forward together so that we can help with OSPI and Learn to Return and our partners at Health Common help you all support your school communities going forward as you wrap up this school year and plan for next. And you're going to hear a lot more about that from our colleagues over the duration of this call. I do want to note that as we wrap up this school year, I want to take a moment to reflect on the tremendous efforts schools in particular have made in going above and beyond to offer COVID-19 testing and other prevention measures and tools to help keep students, staff, and their families safer. There are two quotes that I have been sharing at different points and with all of the variety of sectors that have been involved. And the first is by Michael Levitt, who is a former Secretary of Health and Human Services. Prior to this pandemic and even the previous H1N1 pandemic, he included this quote in a book around pandemic influenza planning. Everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. And the second quote is from former Secretary of State Condoleezza Rice. There is no greater challenge and there is no greater honor than to be in public service. And those of you who educate children provide one of the most important and essential public services. And you've been on the front lines doing this challenging work during a pandemic, which is even more challenging for 3+ years now. We want to recognize the Herculean efforts on the part of schools to bring learners back into school buildings during the early phases of the pandemic, implementing those layered safety measures to slow disease and help us save more lives as a state, as Dr. Kwan-Gett mentioned, and the really hard decisions that you all had to make on a daily basis to juggle the obligations to your students and staff while working alongside and in partnership with public health to respond and keep our community safe. So as a parent and a public health leader, thank you for your tireless efforts and your partnership on this journey. I also want to thank our partners at OSPI, Michaela and others, for the ongoing collaboration, our partners at Health Commons, and all of us working together to champion opportunities to support our schools, our students, the staff, and their families. So thank you for everything you've done to keep yourselves healthier and safer during the pandemic, as well as your schools and broader community. And I will turn it over to Dr. Miller.
All right, good morning, everybody. Thanks for having me today. I'll just echo the statements from my colleagues over at DOH. Thank you. I'm proud of our state as I talk with other states as we come out of the pandemic. I'm proud of the work that we've done here in Washington. We put health and safety first for our students, our staff, and that was key to getting through this pandemic together. Definitely proud of the work that we did at the state level, but as I talked with educators over the last 3 years, so proud of the work that educators, paraeducators, school nurses, counselors, school bus drivers, nutritional services, you name it, pitching in different ways over the last 3 years to make our kids healthy and safe and at school and learning. It's a delicate balance between the health and safety and the student learning focus. It was a very challenging 3 years of decision making and hard decision making. Between that balance, I spent 12 years in the classroom, and I know health and safety was always the forefront, even before the pandemic, of our students. And so that delicate balance really was a highlight of the last 3 years. As we come out of it, I'm excited. I also want to shout out to Sarah Sutton, who it seems like just has been here all the way along and on these calls and calm and cool and collected, and has really led the work at Health Commons in unbelievable ways. And I think we don't often reflect on the components of our system that really made it function and work. And, you know, we were one of the few states that had the kinds of resources available to all schools and all communities. And it's thanks to DOH, Sarah, Kim, everybody that pitched in and did their part in this work. So kudos to Sarah and the whole team at Health Commons for your work. Finally, just looking forward, I'm excited about the work ahead of us, and also nervous and not specifically around COVID in particular, but the dynamic work that we did with DOH over the last 3 years showed that there is more work to be done between health and safety and our schools. And in different ways, I think we need to explore those balances of and I know Anna Marie is sick of me talking about this, but the balance between what a school does and what the health or human services component of the community does. And that is a big task. I don't think we have those solved just came off a call with paraeducators around behavioral health and the work that's being done in schools right now. And so our work is never done, and we're just entering a new phase of it. And I just want to thank each and every one of you, whether you worked in a school or at an ESD or in the community, helping serve our students, our 1.1 million students in the state. Critically important, and thank you for your work.
Thank you, Dr. Miller, Dr. Kwan-Gett, and Lacey Fehrenbach. Really appreciate those opening remarks and helping set the tone for this session. I know the three of you are very busy. To Michaela's point, more work to be done. So if you need to exit, just thank you again. The recording's available if you'd like to watch afterwards. And with that, we'll move to our next slide, and I'll welcome Kimberly Sanchez to the Zoom room. Kim is the Education Engagement Director of K-12 and Early Learning at DOH in the Office of Strategic Partnerships. Welcome, Kim.
Thank you so much, Sarah, and good morning. It is such a privilege to be here, and I so appreciate what has already been shared from our joint senior leadership. And what that has me thinking about as an education engagement director here at the agency is really our commitment to this ongoing relationship with our school partners. It's a privilege to be here with you today as I think about this event occurring in the month of May, where we honor National School Nurses Day, where we honor school principals, where we honor educators, Teacher Appreciation Day, Teacher Appreciation Week. Every day should be an appreciation day for educators and all those connected to the school space. We are so grateful for the work that you have done, that you continue to do. When I think about my role at the agency and where I came from and what has been shared today, really the purpose, the ongoing purpose in thinking about the needs coming during the duration of the pandemic, and then thinking future forward, as I think about like what Dr. Miller was sharing, is really how do we as an agency at the Department of Health, how do we look for the intersections between our work and schools? How do we strengthen those relationships? Moreover, how do we listen well to our partners and use that information to make decisions, to look at these shared priorities that we have? And when I think back to the beginning of the pandemic, at that time, I was an administrator in a small middle school. And I remember sharing with my staff, and when I think about you out there listening to these words, I remember thinking about what was being asked, the pivot to virtual learning, how to keep pace and touch with our students with all the screens being dark with just names, bringing kids back. And I was thinking about Apollo 13, when you see the scientists and you see them with the filters, and they're like, we have this round filter, we have the square filter, and we have to figure out how to make this fit here. And that is what the educational system did at this critical point in time. They innovated, they collaborated, and they worked together to create something that really hadn't existed previously in that realm. And so it is a privilege to learn from you as we continue to partner and continue to want to engage in this work together, knowing that many of the things that Dr. Miller brought up are things that are ongoing challenges. There were challenges before the pandemic, throughout the pandemic, and as we continue to respond to the pandemic and into the recovery phase of this impact on littles and youth and the humans that tend to them. So part of my work, just very super briefly, has been to look for all the threads within the agency that intersects with schools. What you see up on the slide is really sort of those big buckets of where that work lives. And future forward, what you'll see coming up in the next school year that we're excited about is being able to really work towards better access to the work that intersects with schools. So what I'll just highlight at this point in time and encourage you to look for in the new school year is of the many things that we are committed to, one thing that you'll see, those big buckets that you saw on the last slide, you'll see highlighted on the existing schools landing page as a kind of a one-stop shop to access these different programs, ideas, and resources at the intersection of public health and schools. My work is really about fortifying partnerships, not only with our external school partners. When I think about this pandemic, I think about how there was this existing infrastructure of support. ESDs have always been those supportive pieces, OSPI, and then being able to leverage the strengths of these partners as we responded and as the pandemic changed over time. And so I look forward to these ongoing partnerships with our partners at OSPI in a variety of programs and with our ESD partners as each of these agencies work to support your hefty lift and work with children at school, in the school space. And so with that, I'd like to turn the time over to Assistant Superintendent Anna Marie Dufault from OSPI, who is going to share a little bit about her work as well as make some additional remarks. So thank you again, and look forward to our ongoing collaboration and partnership as we work to address these areas that we share. Anna Marie.
Oh, thank you so much, Kim. And what a privilege it is to be on the screen with all of you. And I also was a principal during the pandemic, and I owe you a debt of gratitude for all of your guidance that you provided, the masks that you got to us through our ESDs so that we could send home meals with children. And I just really thank you for your hard work so that we could have school open. I do have the privilege of getting to work with Kim Sanchez, and we have already partnered on several public health initiatives, and I look forward to doing more in that arena. However, I would be remiss without mentioning someone who, if you're ever going to be part of a global pandemic, you want this person on your team, and that person is Martin Mueller. He is transitioning from his previous role here at the agency as Assistant Superintendent of Student Engagement and Support, and he's actually returning to retirement, or he's going to learn to retire. And Martin is someone who is very graceful at navigating the intersections and intricacies of both public health and public school systems. He understood how the contracting processes worked so that we could quickly get funding and resources out to schools. He also knows where to leverage resources. And for that, Martin, on behalf of a very grateful state and a very grateful education system, I thank you for your leadership, your vision, and your commitment during this time.
Alrighty. Welcome, Michelle Chung, School Testing Supervisor at DOH, here to talk about COVID-19 testing changes through the PHE ending, as well as what schools can expect next year. Reminder, please put your questions in the chat. If we can't address them, we will get you a written response next week. Michelle.
Yeah, thanks, Sarah. So as Lacey alluded to this earlier, I know that there's been some communications that was sent out around the impacts coming from the end of the federal emergency. And so as that happened on May 11th, DOH did develop some talking points that was released on how those changes impact school implementation in Washington K-12 schools. If you are looking for those talking points, we've hyperlinked it as one of the first bullet points on this slide, but you can also find it on the DOH school testing website. With the end of the emergency, what DOH determined was that we were not able to, as an agency, to continue prior standing orders or to have the authority to issue new standing orders and authorizations in the flexibilities that we had in the last couple of years. However, what we did determine internally was that there are existing state laws that continue to support the administration of COVID-19 tests in schools. Some of the highlights that I will point out from the talking points are that the PrEP Act continues to cover registered nurses as persons having liability from the PrEP Act as they use tests from federally funded programs like ours, Learn to Return. And the state law allows for our RNs to continue point of care testing and CLIA waived tests in schools. We do recognize that schools are looking for additional clarity on our talking points and specifically around nurse delegation to unlicensed individuals. We are currently connecting with the Nursing Care Quality Assurance Commission to issue a letter to provide more clarity into your questions as it supports COVID-19 testing. In the interim, I would recommend connecting with your school leadership to understand, how that process is determined for your district. I also got some recent news that HHS actually issued another amendment, their 11th amendment to the PrEP Act. And we are also working internally to understand what those expansions to coverage are for state authorized providers administering tests. And we're going to work on updating our DOH talking points to have that made available in the coming days. I do want to take some time to recognize that the information that has been released is hard to navigate and was released very closely to when the public health emergency ended. We've been trying to get clarity for quite some time to try to get these talking points ahead out to schools as soon as we can, but understanding that there's only a few weeks of school left, and also understanding that you guys have a lot of priorities on your end just to close out the school year. A general recommendation is feel free to transition to distribution of over-the-counter tests as we work towards providing additional resources to give to schools. And we want to give you a chance to have more time to make decisions. Understanding there's still a lot of moving parts in the work that we're trying to accomplish in providing clarity. I do want to encourage that if you have any questions that are really related to nursing practice, scope of work in that sense, and delegation issues, feel free to drop that to the nursing practice inbox, and they will be able to help support some of those conversations and questions that you have that are specific to that role. And as we transition and think about next year, we did want to give a sneak peek into the COVID-19 testing resources that would be available for the following year. We are actually really excited to announce that DOH will still be offering free COVID-19 tests to schools. Schools can continue to order point of care tests and over-the-counter tests from the school ordering portal in the fall. Maybe just as a quick reminder, schools that want to continue doing point of care testing will need to renew their CLIA waiver, or also called MTS licenses. We'll be working with Health Commons and others to ensure that we're going to be sharing additional information about that in an upcoming Learn to Return newsletter. We've also gotten some questions about the use of expired tests. Also, as a gentle reminder, if your school has expired tests on hand, please reference DOH's guidance on how that may be used, ensuring that you check the date expirations and quality control checks are in place for you to continue use of these tests. For next year and in the current year, we would want to recommend, if you have any questions, broad questions that you have about COVID-19 testing, any concerns that you have, yes, these are still your primary points of contact that you can continue reaching out to. And then also making sure that schools are aware that you can still reach out to your Health Commons program managers if you need support with technical assistance or questions related to vendor offboarding. There are some notable resources that we've had in the last 2 years that will sunset by the end of this year. And those ones are listed on the slide, but I will indicate that the Labor Support Fund, the Impact Fund, External Labor Support Assistance, and PCR testing will be sunset by the end of this year and won't be available for the upcoming school year. And lastly, maybe just a gentle reminder here. I know a lot of schools have been interested in the Labor Support Fund and has been highly utilized in the last 2 years. This fund does officially end by July 31st, 2023, as that was made possible through our federal grant dollars. For those of you that have been in this with us since the beginning, this funding opportunity was officially launched in August 2021. So I wanted to highlight just a few key takeaways for schools as they prepare to submit their last reimbursement submissions. We are asking schools to submit all of their reimbursement claims no later than August 9th of this year. If you have any outstanding claims for prior months, either late 2022 or early 2023, we do encourage submitting these ahead of August. And if you have any questions around reimbursements, we would recommend reaching out to your Health Commons contacts here, Jasmine and Mike, for further support. I will hand it back to Sarah. Thank you.
Thank you very much, Michelle. Appreciate all the questions in the chat. We see them. We will respond to them in writing next week. As Michelle mentioned, your ESD coordinator, your Health Commons program manager are also available to you to get answers to these questions as quickly as possible. All right, moving on to K-12 guidance. Sam, welcome. Thank you for joining us today.
Good morning. My name is Sam Rice. I'm an epidemiologist on the non-healthcare congregate settings team at DOH, and I'm the lead for K-12 school outbreaks and youth setting guidance. So today I'll be providing an update on the changes that are expected to our K-12 school and childcare guidance. So I plan to just provide an overview of all the changes that you can expect to see in the guidance to prevent and respond to COVID-19 in K-12 schools and childcares. And I also want to share our plan to sunset the interim SARS-CoV-2 self-testing guidance for schools and childcare providers. So that guidance document covered details about self-testing, schools using the waived medical test site license to administer testing, and also the requirements for case reporting for K-12 schools. But with the current changes, a lot of the information is outdated, and we're going to be directing to more relevant guidance documents. We will be updating the guidance to prevent and respond to COVID-19 in K-12 schools and childcares, and we plan to release the new guidance by the first week of June, and that'll most likely happen on Tuesday, May 30th. I want to emphasize that while we're releasing the guidance before the end of the school year, it is not the intention of DOH that K-12 schools change any policies or practices between the release of the updated guidance and the end of the school year. There's no expectation for K-12 schools to review and implement any guidance changes prior to the end of the current school year. We're releasing the guidance at this time to give schools a chance to review the guidance in preparation for the 2023-2024 school year. Compared to previous updates to our guidance, there are far fewer changes in this iteration, and the changes are really meant to simplify school operations and remove any expired or outdated references, but there aren't any new requirements in the updated guidance document. So I'll go over these. There are a couple changes related to removing expired requirements and metrics, a couple changes to simplify school operations, and we've expanded respiratory illness recommendations. So the first change you'll see in the updated guidance document is that we've removed the Washington Secretary of Health mask order. So that mask order ended on April 3rd of this year. The mask order applied to schools in that it required universal masking in school nurse offices and health rooms, as those were considered healthcare settings. We no longer have that mask mandate for healthcare settings, but anyone who's working near or providing care to a person who's known to have COVID or who has COVID symptoms should still wear appropriate personal protective equipment or PPE, and that would include a well-fitting and high-quality mask or respirator. We still direct employers, including K-12 schools, to refer to the L&I requirements and guidance for preventing COVID-19, which will have additional details on the level of respiratory protection needed for employees. And while we don't require universal masking, we do acknowledge in the guidance that masking may be necessary or appropriate in response to an increase in cases, to high absenteeism due to respiratory illness, or in response to an outbreak. And there may be times when the school, the district, or the LHJ may require masking in outbreak situations. All right, we've also removed recommendations that reference the CDC COVID-19 community levels. The CDC is no longer calculating those COVID-19 community levels. So where previously in our guidance, we recommended that K-12 schools monitor the community levels to implement layered mitigation strategies when community levels are high. We now recommend additional strategies for COVID prevention during outbreaks or when there's high absenteeism due to respiratory illness. So instead of looking at those community levels, to look at your school-based metrics. All of the recommended mitigation strategies are described in detail in that guidance document. Those can include masking, improving ventilation and screening testing. There are no new recommendations in that regard. So it'll be the same and very similar information to what we've had in the past about preventing and responding to outbreaks in schools. So I know that this is a topic we've gotten a lot of questions about. In the new guidance, we've removed the requirement to report positive results from at-home tests or from tests that are administered by healthcare providers or labs outside of the school or childcare to the local health jurisdictions. So previously, our guidance stated that schools are required to report every case to their local health jurisdiction. That had included cases that were identified through home tests or through healthcare provider administered testing. When schools were notified of those cases, so for example, if a child was out sick and the parent called the school and let them know that they had tested positive from a home test, they were required to report those cases to their local health jurisdiction. We no longer have that requirement. Moving forward, schools will be required to report test results if they continue to administer tests at the school. And there's more information on those reporting requirements in our point of care test reporting for K through 12 schools website, which is linked here. It's also linked in the guidance document. But the requirement that every case be reported to local health jurisdictions is going away. Because those case reporting requirements for schools and childcares are now aligning with the requirements for other establishments, we're sunsetting the interim SARS-CoV-2 self-testing guidance for K through 12 schools and childcares. In its place, we recommend that schools and childcares refer to the self-testing guidance for establishments. So that guidance document is going to be updated at the same time that we sunset the guidance specific to K through 12 schools and childcares. The update will include any information that's really specific to schools, childcares, and other youth settings. So you'll have all the information that you need there. And we also recommend referring individuals and families to our COVID-19 self-testing guidance, which is intended for the general public and has more information about self-testing. Another change, we are no longer recommending exposure notifications of individual COVID-19 cases to staff and families. So in the current guidance document, we have recommendations for exposure notifications for any cases and that those go out to staff and families. Moving forward, we would recommend that schools have a process in place to inform staff and families if there's an outbreak in the school or childcare setting, but not if there is just a single case. So that could apply, for example, if there's an outbreak specific to a sports team, or, we would recommend that you inform the families and staff that are associated with that team that there's an outbreak on the team. If there's, an outbreak in a classroom, we would recommend informing the class. And if there's a larger school-wide outbreak, we would recommend notifying the whole school community of that outbreak. All right, the last change is that we have added a new paragraph with considerations for flu, RSV, and other respiratory illnesses. This includes recommendations for preventing and responding to respiratory illnesses and resources for additional information on RSV, flu, and the flu vaccine. This section does not have any new requirements. We added this section in response to a need that we saw from schools, childcares, and local health jurisdiction partners last fall. With the high rates of RSV, flu, and COVID, and the difficulty in distinguishing between these illnesses in the absence of testing, we want to acknowledge that challenge and just to provide some general guidance to support schools and to point folks in the direction of appropriate resources for those situations. All right, I will review the questions in the chat and plan to follow up with Sarah so that we can respond to all of those questions in writing. And thank you all so much for your time and for your adaptability in these iterations of guidance.
Thank you, Sam. Appreciate the time today. Appreciate the advance notice as well. For our final content portion of this webinar, I'd like to welcome Lillian Manahan to review some data, provide a surveillance update, help fill in some of the context from the numbers. Lillian, welcome.
Good morning, thank you. My name is Lillian Manahan. I'm an epidemiologist. I work in the surveillance section within the Center for Data Science. Just wanted to start with a quick update of what we're seeing in the data. This is case rates by ESD since January 2023. And what we're seeing is that there's been a decreasing trend pretty steadily since February. But I also just want to highlight that we know with the increased use of at-home tests, testing data and case data are becoming more unreliable. So we sort of need to take this with a grain of salt. But in general, we're seeing decreasing case trends across the ESDs. This shows hospitalization rates going back to 2022. And as you can see, similarly to cases, we're seeing decreases in recent months as well. Some of the lowest hospitalization rates in 0 to 18-year-olds that we've seen since the beginning of the pandemic. I also wanted to just bring your attention to the tools we have currently available to view COVID-19 data in school-aged children. The first is a report called COVID-19 Cases Among Children and Youth in Washington. And this report shows case and hospitalization rates at the ESD level, and it uses a geocoding approach. So it's just based on where an individual lives. It doesn't necessarily mean they attend school in that region, but just based on limitations to the testing data, this is the best we can come up with for how to show what's happening in each of the ESDs. So this report is released monthly on the DOH dashboard site. It shows cases and hospitalizations over time by ESD and by age group. We also have our COVID-19 data dashboard. This shows data in different age groups that are listed on the slide, and you can look at cases, hospitalizations, deaths, and different variants, and also can stratify by county, ACH region, Eastern versus Western Washington, and various demographic features. And the dashboard is updated each Wednesday. There are not geographies specific to schools on our current COVID data dashboard. Coming in fall 2023, we will be sunsetting our COVID-19 dashboard and replacing it with this, we're calling it the Respiratory Disease 2.0 dashboard. That's going to include COVID-19, flu, and RSV from a variety of data sources. In this dashboard, we're trying to de-emphasize case data and put more emphasis on severe outcomes, such as hospitalizations and deaths. So a variety of different data sources will be pulled in that are listed on the slides, in addition to multiple sections related to health disparities, including age, sex, and race and ethnicity categories. And the primary goal of this expanded dashboard is to streamline information on major respiratory viruses for various audiences to aid in decision making. So if folks have thoughts about data products that they would like to see moving forward, or if the current data products that we're providing meet your needs, that would be great. Feel free to reach out to me and let me know your thoughts, feedback on what we're producing and what would be useful moving forward. That's it. I'll hand it back to you, Sarah. Thank you.
Thanks, Lillian. We're making good time in this webinar, so I will invite our speakers to consider looking at the questions in the chat. Is there any question that you would like to address verbally to this group right now, knowing that we will still follow up with written clarification? So speakers, as you're doing that, I'm going to wrap us up, and then I'll invite you to come off mute and clarify any hot items in the chat that you'd like to do with this group together. So as they're doing that, a reminder that we will send this recording out to all of you later today or early tomorrow. We will also post it on the Learn to Return website, so your colleagues who weren't able to attend today can still have this information. We will respond to the questions in the chat in a written format via the Learn to Return newsletter on May 25th. There's a link for you to subscribe if you aren't subscribed already. We would appreciate feedback on this webinar on the Learn to Return Learning Network. I just dropped a link in the chat. If you're willing to take a couple of moments to give us feedback on this presentation, that would be helpful for all of us and our speakers. There's also a text box in there. If you'd like to ask a question anonymously, we can include that in the written follow-up next week. For those of you who would like to share even more feedback about the Learn to Return program, about COVID-19 testing in schools, I invite you to reach out to your ESD coordinator to join a listening session. The 9 ESDs are facilitating listening sessions. It's a chance for you to give direct feedback that will be rolled up to DOH and the other Learn to Return partners. We appreciate those of you who have already participated in those sessions. So you can email your ESD coordinator if you would like to participate in one of those sessions. I think that they run about an hour. So with that, I will return to our speakers, our panelists. Would any of you like to come off mute and address a specific question or theme of questions in the chat?
Yeah, and Sarah, I raised my hand just in case. I don't want to interrupt others. I do recognize all the questions around testing and how complicated that is. So I saw 2 themes here, and hopefully I can help at least provide some information and clarity around some of the questions I've seen in the chat. For the very first one, see if I can drop it to everyone. I think there's been a lot of questions about the use of expired COVID-19 tests. And so at this point in time, DOH hasn't changed their stance about whether or not you can use an expired test. All the information that you need to know about whether an expired test is still good to use. There's 2 main things, but I would recommend going to that FAQ, reviewing that, either reviewing that extended shelf life, and if it is no longer extended, checking those quality controls within your test, ensure that you can continue utilizing it. Please reference that link. Secondly, I'm going to drop the other link because I wasn't sure if we had enough time, but here is the link of the talking points that Washington State sent out about, what our stance is and what we've been able to interpret from the rollback from 5/11. I do see that there's been questions. And I think the really short takeaway from this is, if you are a nurse or you have a nurse within your school that is a registered nurse, and you should reference the Nursing Care Quality Assurance Commission link that has an opinion about who within the school setting is allowed to do those delegations. But I do want to confirm, registered nurses can still continue administering these point of care tests. I think the question that has been a hot topic here is, what does that mean for unlicensed school employees? And for unlicensed school employees to continue doing COVID-19 testing activities, that would require a delegation from their nursing or registered nurse. And so knowing that, I don't know what that process technically always looks like within your district or school, I do recommend having an internal conversation around what that process generally looks like for your school. But I would start those conversations with your school and your leadership team using the talking points and document that was shared out from DOH that gives you and points you to what we've interpreted as permittable from state law. Understanding still, some of it is kind of legalese and dense to get through. We're going to work with the Nursing Commission. We're talking about getting a letter out to schools to make this more clear, and we're working on that right now. And so I think as schools are still having lots of questions, if you're still having questions after reading this and having discussions with your leadership team, with your administration, I'm just recommending maybe the easiest way is transition to over-the-counter tests to give your school more time to think about how you guys want to pivot your strategy or how you want to modify it. But I want to give you guys that opportunity to make those changes if that's an easier route.
Thanks, Michelle.
Maybe I'll address that one last question that came in about CLIAs, because I realized I missed that as well. If you're performing tests on school grounds, which we technically call point of care tests, then yes, you will need a CLIA. But if you're not doing tests on school grounds and you're just distributing tests and you're not resulting them on school site, you don't need a CLIA for that. But we will we've noted there's lots of questions about CLIA. We will get more information in the next newsletter, and I'll turn it over to other colleagues that may want to join in on the questions that have been posed in the chat. Thank you, everyone.
Thank you, Michelle. Sam, would you like to come off mute and address any of the questions in the chat?
Yeah, I'd be happy to. Thank you. So I have been looking through the chat, kind of difficult to take in all of the questions, but I noticed a few buckets that are applicable to our guidance that I wanted to address. So the first is our outbreak definition. That hasn't changed. It's in the current guidance and it'll be in the updated guidance. We consider an outbreak when we have 5 cases that are in a specified core group. So that can be 5 cases in a classroom, 5 cases on a sports team, or 20% of students in that group. So for example, if you have a very small group, if you have an extracurricular activity with, 8 participants or a team of 10 or something like that, and you have 3 cases, you would want to consider that as an outbreak as well. I would recommend anytime, if you're uncertain if you have an outbreak, to just work with your local health jurisdiction. So you can always reach out to them. They'll be happy to talk to you and provide some more information and context. But when you have those cases, they have a symptom onset or their positive test result was within a week of each other. And there's no clear evidence that they were epi-linked elsewhere. So for example, if you have cases, but they're all siblings, that's probably not a school outbreak. So when you have an outbreak in a school, or if you're uncertain, you can work with your LHJ to determine if something does count as an outbreak or not. Another question, we got some questions about the L&I guidance. We don't specifically address the details of the L&I guidance in our guidance, but we do link to it, and I'll put links to that in the chat box for everyone. It'll also be in our answers in the notes that go out. If you have questions about the L&I guidance, again, I recommend reaching out to your local health jurisdiction who can help contact L&I directly to answer those questions. And then I also saw some questions about our recommendations for the 5-day isolation period. So that is currently a recommendation in our guidance, and we will continue to recommend the 5 days of isolation for anyone who tests positive for COVID. That isolation recommendation is in alignment with our the CDC recommendations for isolation for anyone who has COVID. We know that some states have started to change those recommendations, and we'll continue to follow CDC and have those conversations. But currently, we do continue to recommend that anyone who is known to have COVID isolates for 5 days. And there's more details, again, in our K-12 school guidance document about those isolation recommendations.
Thanks, Sam. Appreciate that. We will look for those links in the chat and then send them out afterwards as well. Kim or Lillian or Anna Marie, anything that you'd like to say in these last few minutes?
I think the last thing that I would just add, not really speaking specifically to any of these questions, but just reiterating that we really appreciate your perspective and the questions that come from that, so that then we can look at those concerns and then be able to respond to those concerns. So very much appreciate you sharing the impact in your space so that we can be responsive to that. So again, thank you so much for this continuing needed partnership and overall just beneficial partnerships that are in support of our kids. So thank you so much. Thank you so much for all of these questions, for certain.
Yes, I'll just chime in here, Kim, to echo that. And then also we have a school nurse here at OSPI, and I will be sharing the contents of this webinar with her and the questions and answers that you're having so that she can help to get that information out more broadly. So thank you.
Thanks, Anna Marie. Thank you, Kim. Have an excellent summer, everyone. It's been a pleasure working with you this year. Take care.